10 Ways to Control High Blood Pressure Without Medication. By making these 10 lifestyle changes, you can lower your blood pressure and reduce your risk of heart disease. If you've been diagnosed with high blood pressure, you might be worried about taking medication to bring your numbers down. Lifestyle plays an important role in treating your high blood pressure. If you successfully control your blood pressure with a healthy lifestyle, you might avoid, delay, or reduce the need for medication. Here are 10 lifestyle changes you can make to lower your blood pressure and keep it down. 1. Lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. Being overweight also can cause disrupted breathing while you sleep apnea, which further raises your blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. In general, you may reduce your blood pressure by about 1 mm of mercury with each kilogram of weight you lose. Besides shedding pounds, you generally should also keep an eye on your waistline. Carrying too much weight around your waist can put you at greater risk of high blood pressure. Men are at risk if their waist measurement is greater than 40 inches. While women are at risk if their waist measurement is greater than 35 inches. 2. Exercise regularly. Regular physical activity such as 150 minutes a week, or about 30 minutes most days of the week, can lower your blood pressure. It's important to be consistent because if you stop exercising, your blood pressure can rise again. If you already have hypertension, regular physical activity can bring your blood pressure down to safer levels. Some examples of aerobic exercise you may try to lower blood pressure include walking, jogging, cycling, swimming, or dancing. You can also try high-intensity interval training, which involves alternating short bursts of intense activity with subsequent recovery periods of lighter activity. Strength training also can help reduce blood pressure. Aim to include strength training exercises at least 2 days a week. 3. Eat a healthy diet. Eating a diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products and skims on saturated fat and cholesterol can lower your blood pressure. This eating plan is known as the Dietary Approaches to Stop Hypertension (DASH) diet. It isn't easy to change your eating habits, but with these tips, you can adopt a healthy diet. Keep a food diary. Writing down what you eat, even for just a week, can shed surprising light on your true eating habits. Monitor what you eat, how much, when, and why. Monitor what you eat, how much, when, and why. Consider boosting potassium. Potassium can lessen the effects of sodium on blood pressure. The best source of potassium is food, such as fruits and vegetables, rather than supplements. Read food labels when you shop and stick to your healthy eating plan when you're dining out. 2. 4. Reduce sodium in your diet. Even a small reduction in the sodium in your diet can improve your heart health and reduce blood pressure. In general, limit sodium to 2,300 mg a day or less. However, a lower sodium intake of 1,500 mg a day or less is ideal for most adults. To decrease sodium in your diet, consider these tips. Read food labels. If possible, choose low-sodium alternatives of the foods and beverages you normally buy. Use herbs or spices to add flavor to your food. If you don't feel you can drastically reduce the sodium in your diet suddenly, cut back gradually. Your palate will adjust over time. 5. Limit the amount of alcohol you drink. Alcohol can be both good and bad for your health. Generally 1 drink a day for women, or 2 a day for men. You can potentially lower your blood pressure by about 4 mmHg. 1 drink equals 12 ounces of beer, 5 ounces of wine or 1.5 ounces of 80 proof liquor. Drinking more than moderate amounts of alcohol can actually raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. 6. Quit smoking. Each cigarette you smoke increases your blood pressure for many minutes after you finish. Stopping smoking helps your blood pressure return to normal. Quitting smoking can reduce your risk of heart disease and improve your overall health. People who quit smoking may live longer than people who never quit smoking. 7. Cut back on caffeine. Caffeine can raise blood pressure up to 10 mmHg in people who rarely consume it. But people who drink coffee regularly may experience little or no effect on their blood pressure. Although the long-term effects of caffeine on blood pressure aren't clear, it's possible blood pressure may slightly increase. To see if caffeine raises your blood pressure, check your pressure within 30 minutes of drinking a caffeinated beverage. If your blood pressure increases, you may be sensitive to the blood pressure-raising effects of caffeine. 8. Reduce your stress. Chronic stress may contribute to high blood pressure. Occasional stress also can contribute to high blood pressure if you react to stress by eating unhealthy food, drinking alcohol, or smoking. Take some time to think about what causes you to feel stressed, such as work, family, finances, or illness. Once you know what's causing your stress, consider how you can eliminate or reduce stress. If you can't eliminate all of your stressors, you can at least cope with them in a healthier way. Focus on issues you can control and make plans to solve them. Understand there are some things you can't change or control, but you can focus on how you react to them. Make time to relax and to do activities you enjoy. Expressing gratitude to others can help reduce your stress. 9. Monitor your blood pressure at home and see your doctor regularly. Home monitoring can help you keep tabs on your blood pressure and alert you and your doctor to potential health complications. Blood pressure monitors are available widely and without a prescription. Regular visits with your doctor are also key to controlling your blood pressure. If your blood pressure is well controlled, check with your doctor about how often you need to check it. 10. Get support. Supportive family and friends can help improve your health. They may encourage you to take care of yourself, drive you to the doctor's office, or embark on an exercise program with you to keep your blood pressure low. If you find you need support beyond your family and friends, consider joining a support group. This may put you in touch with people who can give you an emotional or morale boost and who can offer practical tips to cope with your condition. Consider subscribing and hit the notification bell.